Welcome to Glass Half Full with Leslie Krongold. She shares her stories, experiences, and knowledge of living and coping with a chronic health condition. Learn about tools and resources and hear inspirational interviews that help you to live a life filled with quality and dignity. With 2 decades of support group leadership, Leslie's ready to help you make lemonade out of life's lemons. Are you ready?
Hello and Happy New Year to you. Happy New Decade. I was going to close out 2019 with this episode on sleep, hoping you could use some of the tips during the frenzied holidays, but I got too frenzied. So now you can add this to your New Year resolutions. Heck, I'm always looking for new advice or research to help my sleep and rest routines. I've been scrutinizing my sleep for a while now. I've made changes to my daily rituals, all with the intention of improving my night's sleep. I know sleep issues are common amongst my patient community, amongst my friends, pretty much across the Western world. There are many books about improving your sleep. I've read many of them. In the Glass Half Full Facebook group, I did an informal poll asking people about their sleep. There were 4 options. Do you have trouble falling asleep, staying asleep, waking up, or is your sleep perfect the way it is? Well, no one responded to the last option. The majority of the respondents had trouble staying asleep. And that's usually my problem, though here and there I have nights where I just can't fall asleep. At the end of this episode, I'll share some of my sleep hygiene tips with you. Everyone's different, so I don't know if they'll help you, but I think I found a great guest for this episode. Her name is Darley. Dr. Darley is a naturopathic doctor, and these types of doctors are guided by principles that include the healing power of nature. They first try treatments that are of a lower force and have fewer side effects, like behavioral or dietary treatments. This happens before prescribing any pharmaceuticals, and that philosophy certainly appeals to me. I met Dr. Darley at a day-long class she taught about sleep and mental health. It was geared toward therapists, counselors, and nurses. I was incognito. She travels around the country teaching people about sleep research. You can check out her website. The link is in the podcast notes on the Glass Half Full website. What is a sleep specialist?
So a sleep specialist is a physician who has not only the training of primary care, but has also gotten specialized training in sleep as a student, and there is actually an Academy of Sleep Medicine, which is part of the American Academy of Medicine.
And is it like a subset of neurology, or is it just completely its own specialty?
It's entirely recognized in its own right. Sleep medicine is actually a relatively new discipline of medicine compared to some others like cardiology or respiratory medicine. The annual sleep meeting has only been happening for about 27 years. So it's a relatively new discipline in light of some of the longer history of other disciplines. Yeah.
Okay. Yeah, it's interesting. I wonder if it's a comment on society, or is our sleep, has it just become progressively worse?
Yeah, I don't know. I think that, sleep's interesting to me in in our social standing, because even though we all sleep and we all must sleep, it seems like it's been an area that really hasn't gotten much focus until the last 30 years or so. And that's kind of surprising considering how essential and how basic it is.
But did we know how important it was, more than 30 years ago? Do we just take it for granted, maybe?
I think it is taken for granted, although there was certainly research being done since the 1940s, if not earlier, looking at sleep. And one of the first, when I first started getting interested in sleep, was about 1991 in college. And so I was doing literature reviews and reading research papers. And at that point, we knew that at least animals would die without sufficient sleep. So I think that's a pretty good indication of how essential it is. And, early 90s, it's a long time ago. And the research I was reading at that point had been, conducted in the 10 or 15 years prior to that. So we've certainly known for a long time how essential it is.
So what did bring you into this field of expertise? Was it those, that research that sort of lit a fire for you? Or?
I have always found sleep very just personally interesting to me. I've always been a pretty good sleeper, and I've really, my parents, my household that I grew up in prioritized getting sleep, and I've prioritized getting enough sleep. And so I'm really very aware of what happens to my experience personally when I don't get enough sleep. And so that's part probably of what motivated me. I also, when I was a kid, I sleepwalked into the neighbor's house when I was 12, which was a pretty noteworthy experience, and I think piqued my interest. Yeah.
So, so did that run in your family, or was that an anomaly, or did you have an issue with sleepwalking?
I don't believe that sleepwalking ran in my family, but I was a little bit of a sleepwalker. That was the most extreme case or example of my sleepwalking, but there were a few other times that I would sleepwalk, and the last time was when I was in college, about age 21.
So how it ended abruptly? I mean, did you cause it to end abruptly by
No, I didn't do any treatment. Sleepwalking is something that people often outgrow. It kind of peaks when people are around 7 to 12 years old, although certainly there can be adults who sleepwalk regularly, but I'm not one of them.
Okay, well that's good, because you spend time in a lot of hotels with the work you're doing. I'm sure that would be a little scary.
Yes, and for people who are regular sleepwalkers, adults, it can be distressing.
But it seems every magazine I pick up, it doesn't matter what kind of magazine, there's something about sleep. And I've read, a lot of books on sleep. I attended your workshop. I mean, I'm just so intrigued about it, but it seems like perhaps a lot of America is intrigued about it. So I was wondering if you could tell me, some of the statistics about sleep or lack of sleep that contribute to poor physical and
Sure,
mental
I
health.
can. And I wanted to comment on your observation about many magazines now will have articles about sleep, and that it's something that's really captured the interest. A huge uptick in the amount of media interest and attention and public interest years ago. So I think that's a really positive sign for us improving our sleep. On the other hand, there's some new research that evaluated Americans' sleep up to 2018 and found that 36% of Americans are sleeping 7 hours or less is not enough sleep for adults. Most adults, 7 hours or less. So that's an increase in the percentage of Americans not getting adequate sleep. And I think about it impacting 5 domains, Leslie. I think I talked about this briefly in the course, that you've got your physical health and our quality of life and our kind of non-diagnosable symptoms to full-blown diagnosable anxiety, depression, as I think of our physical performance and mental performance. So many people in America operate cars, right, which is a form of, is absolutely impaired when you're sleep deprived. And then there's the cognitive performance. Things from simple memory all the way up to complex problem solving are going to be worse. Your performance will be worse in those areas if you're not getting adequate sleep. And then the fifth, doing appropriately to them, which can cause disharmony in your relationships and your social functioning, basically.
I asked Dr. Darley to tell me about other common sleep disorders, especially insomnia.
We definitely want to be treating obstructive sleep apnea, and there are other sleep breathing disorders, is insomnia. And we think a person's insomnia is chronic if they've had it for more than 3 months, which, 3 months can speed by, right? And someone's acute insomnia due to maybe a life event, a good insomnia continues after that. Other categories would be movement disorders, things like Restless Leg Syndrome. Other categories are circadian rhythm disorders, and this is a category that's getting a lot more attention now as we learn how pervasive our circadian systems are throughout our bodies. One population that really struggles with circadian issues is shift workers. It's about 20% of Americans do shift work where they're commuting to work or working at times that they would naturally be sleeping. That can cause a big problem and actually increase cancer risk. Other two categories of sleep disorders are hypersomnias like narcolepsy, and then the last category is parasomnias, where we see those more abnormal sleep features such as the sleepwalking, sleep eating, those types of conditions.
One is, roughly how common is sleep apnea? And I had recently read just a short little blurb that there are different types of sleep apnea. Can you, elaborate a little on that?
So we think it's somewhere between 5 and 10% of men have sleep apnea and slightly lower percentage in women. But I'd like to make sure that your listeners know that when women get through menopause and they're postmenopausal, at that point the rates of be equivalent to the rates in men. And it's because estrogen has a protective function keeping the airway toned. And as women go through menopause and no longer have such high estrogen levels, their airway is more easily obstructed like men of their age. So that's something to keep in mind for women as they get older. And yes, there are another type of apnea is called central sleep apnea. And the physiology of obstructive versus central sleep apnea is quite different. What happens with obstructive sleep apnea, the brain is still telling the body to breathe, so you'll still see the diaphragm, the chest, rising and falling as the person tries to breathe, but they've got an obstruction in their upper airway, kind of right at the back of the throat usually. But in central sleep apnea, there's a problem with the brain respiratory drive, and the brain is not giving a signal to breathe, and so the diaphragm actually will be still during these apneic pauses, and they're not even trying to then, again, it may pause, no even attempt at respiratory effort. The obstructive sleep apnea is more common in people who have high BMI, high body mass index, but it's not exclusively true, and I think that we generally think that women tend to be more misdiagnosis of obstructive sleep apnea because they tend to be slimmer or smaller people. And so we don't want to just assume that someone who isn't overweight doesn't have obstructive sleep apnea, because thin young women could have obstructive sleep apnea also. It's really, not only is it the entire body habitus, but it's the shape of the airway. So for people who have maybe a small or recessed jaw, they're going to be at increased risk. People who may have a deviated septum and can't breathe through their nose, and so therefore they're breathing through their mouth, that increases their risk of obstructive sleep apnea. Or, if they have a large tongue or enlarged tonsils, making the airway more crowded, it's easier to obstruct. We did, decades ago, think of it more as a overweight person's disease, but now we know it's really mostly impacted by the shape of the airway.
I asked for a bit of an elaboration on the circadian rhythm and how it impacts us.
So our circadian rhythm is many systems in our body that help us stay entrained to the 24-hour a day that we're seeing on our Earth. And it's signaled mostly, and we're entrained to the day, environmental day, by the time that we get bright light in the morning. So, sometimes people really focus on getting to bed at the same time, and that is the most important for sleep. But I would suggest that actually getting up at the same time each morning and getting bright light as soon as you can helps entrain your circadian rhythm and your sleep. We want our circadian rhythm to be robust, so that we are widely awake during the day and deeply asleep at night. One of the things that is really confusing our bodies now in modern lifestyle is the amount of artificial bright light that we have available to us at night, both on our electronics, on the evening, cell phones, tablets, computers, TVs, etc. And then also just with the ambient lighting that we have in our homes. And that actually causes a delay in our sleep hormone, melatonin, and it causes a shorter time of that melatonin is being released each night. So that can impact our sleep.
So in these winter months where, we have less light, and I often wake up here in Northern California, and I don't have a clock in the bedroom, but I look and I think, oh my God, it's like 5 a.m., but it turns out to be 8 a.m. and there's just, like minimal sun. And even you in Seattle, how do you get that hit if it doesn't exist naturally?
For some people, they may choose to use a light box. Other people may choose to just get up, even though it's dark and maybe cold outside, get up at the same time, turn the lights on, really actively start their day. And then as soon as it's light out, a great practice is to go out for a walk, 20 minutes of a walk with the bright outside light. And for those of your listeners who are in Seattle or other places that are known for being overcast and cloudy, even on an overcast morning, it's going to be brighter outside than almost any indoor setting is going to be. And that amount of light will really help clue to your body it's day and switch into daytime physiology, awake physiology. And then I think the other corollary is to purposely be turning down the lights in your home, and not only turning down the brightness of them, but also switch to more historical types of light waveforms that people would historically be exposed to in the evening, which would be your yellow and think sunset or firelight or candlelight, those kinds of hues of lighting. So what I recommend is people set an alarm on their phone or something for an hour, hour and a half before their bedtime. And at that time, they turn off all the lights in their home except for maybe one light, which they've put kind of a yellowish-hued, relatively dim bulb in, so they can still do their recreational wind-down activities, snuggling and talking with the family, or reading a book, or doing some gentle yoga, or listening to a podcast or something, but they're not getting bright light, they're not getting blue light.
I was curious if Dr. Darley could give us more suggestions on how to improve our sleep hygiene.
Nutrition and exercise have gotten a lot more media attention over the last 60 years than sleep has. Well, if you just had the exercise and nutrition piece, that's not very stable, is it? You've got to have the sleep piece. And then I think of some other pieces of a healthy foundation being positive social relationships, loved ones that we can count on and who have esteem for us and we have esteem for them. Another one would be joy, having joy in our lives. And then the sixth, connection to nature. And there's lots of research coming out now about how nature improves our health.
And I know when I've been out in nature or I exercise on a day, my ability to sleep that evening is easier, is enhanced.
So sleep hygiene is basically creating a lifestyle that promotes healthy sleep and a strong circadian rhythm. And so there's many, many components of this. If I was just going to choose out the top 5 components of sleep hygiene, I would say, I mentioned bright light in the morning for 20 minutes, ideally in the first hour or 2 of getting up. Sooner the better after getting up. The second one would be, like I said earlier, avoiding the blue light and the artificial light at night and replicating as best you can naturalistic historical lighting conditions, which would be dim, yellowish, reddish spectrum of light. Would be deciding to give yourself enough hours of sleep, because insufficient sleep syndrome is definitely the most common sleep problem that I see people having, and it contributes to so many domains that can be negatively impacted: the physical health, the physical performance, intelligence. So the way that I think about this, which I'm not sure that other people do, is that if you are an 8-hour sleeper, and that's the ideal amount of sleep for you, that means you can have a 16-hour day. And if you're trying to have 17 or 18 hours of activity each day, you're not going to be getting the sleep you need, and therefore you're going to be having in some domain. And I encourage people to think about the question, would you rather have a long day, or would you like to have a good, healthy day that's shorter because you're getting enough sleep? And I'm not sure that people are thinking about it quite as explicitly or quite in those terms. So that would be the third thing, get enough sleep. The fifth thing is your sleep hours, to rest and sleep. And don't take your daytime roles and responsibilities to bed with you. I think that idea that we've probably all heard of, leave a pad of paper and pencil at your bedside, so if you have a good idea in the night, you can jot it down. I think actually that's a horrible idea, because it trains you to be on all the time, instead of practicing some limit setting that it's okay and it's valid for me to stop taking care of my responsibilities and just rest and sleep and recover and be recharged for the next day when I can pick those up again. So those are my recommendations. And then the fifth one would be about probably exercise and just giving yourself enough wind down time between your active day or eating or exercise and turning lights out. Some people transition more quickly, others need a little bit more time, but kind of evaluating that for yourself and determining how much time you need to wind down so that you're ready to sleep once you're in bed.
Regarding insomnia, does this refer to something more than having difficulty falling asleep? I asked Dr. Darley about waking up in the middle of the night and not being able to fall back to sleep.
Depending on what their problem is, if they are aware of waking up with a gasp in the middle of the night, or if a bed partner or someone sharing the room says that they're snoring loudly or pausing in their breathing at night, they definitely should be evaluated for a sleep breathing disorder. If they're having difficulty within 2 minutes at the beginning of the night to fall asleep, being awake in the middle of the night, or waking up too early, not refreshed, not ready for their day, insomnia can manifest at all those different points in the night. That is something that should be addressed. We know that the more episodes of acute insomnia that somebody has, the greater their chances of having insomnia in the future. So that would be important. And then if they have restless leg syndrome, where they're feeling like they just have to move their legs in the evening, and that movement or that sensation subsides when they move, that would be an indication to go see a sleep specialist. Such high percentage of Americans are not getting adequate sleep. I would really encourage people to do an optimal sleep plan for 2 weeks where they're really prioritizing getting the amount of sleep that they need, and just then noticing how does it impact their health and their sense of well-being. Is it worth it to get more sleep? Does it really make a difference? And how can you do that? That's what I would recommend. And I think I ended with that, Leslie, in our sleep class. I'm wondering if you had the chance to do it, and if so, how did that work for you?
Oh, I know. Yeah, the more I sleep, the better I feel. Years ago, I did my self-care presentation I was doing for my patient in my disease community. And I had, a pyramid like Maslow's hierarchy of needs, but it was based on my self-care routine, and the foundation is sleep. Getting a good night's sleep is critical for my next day. And a lot of what I do during the day is to lead to that optimal sleep experience. So it's based on exercise and winding down stimuli like lights and sounds. I take a hot bath every night. The only thing I do, which is probably contrary to what sleep experts suggest, is I watch a little TV in bed.
I mean, there's these recommendations that we make that are based on physiology, but every person is an individual and has different susceptibilities. I mean, as we know, we've all got probably friends who can drink more and handle it fine. We could give examples in any area of health where we see individual variability. And so I encourage people to follow the rules, and then if they find that they can break them in one area, more power to you.
Dr. Darley has certainly provided us with food for thought. One thing I'll definitely start doing is getting outside in the morning, even if it's overcast. Not mentioned in this podcast, but we did talk about it during our conversation, is starting a sleep journal or diary. There are also online versions or apps to help with this. Dr. Darley believes it's good to document and look for trends rather than relying on your subjectivity. And another way to track sleep and include relevant data is to use a wearable device to sleep. This wouldn't be comfortable for me, but my partner does it and can check to see how much sleep she got the previous night and at what time she may have awakened during the night. I remember from my time receiving regular acupuncture treatments that when you wake up in the middle of the night, can point to issues related to different body organs. This is all part of traditional Chinese medicine. So you might, if you find that you're waking up at a particular time every night, you might want to consult an acupuncturist. Anyhow, as I mentioned in my conversation with Dr. Darley, I am intentional during my day to create a fertile ground for restful sleep. I exercise earlier in the day. I eat frequent small meals, with my last meal several hours before I'm going to go to bed. I do wind down and I limit stimuli such as lights and noise, and I take a hot bath using essential oils like lavender, which is known to have a relaxing effect. And I also take a 1-to-1 THC to CBD tincture sublingually under my tongue about an hour before I anticipate falling asleep. And this routine usually works, but nothing is foolproof. Anxiety can still rear its ugly head and keep me awake or rouse me from a sleep. It's all a work in progress. So rest peacefully, my friends, and when you wake up well rested the next day, turn one of your friends on to this podcast. Thanks for listening.
Thank you for listening to Glass Half Full. Leslie invites you to leave a rating and review on iTunes. This helps spread the word to others dealing with chronic health issues. For show notes, updates, and more, visit the website glasshalffull.online. glasshalffull.online.